Welcome back. You can expect President Obama to focus this week on his plan to overhaul the nation's health care system. It's on the rocks after a report last week predicted it could cost more than $1 trillion and cover just 16 million people out of the roughly 50 million uninsured Americans. So what's the state of play right now on Capitol Hill? Congressman Frank Pallone is a New Jersey Democrat, and he chairs a House subcommittee helping to write the health care bill. Congressman Pallone, thanks for joining us here on Bloomberg.
Hi, Mark. How you doing?
I'm fine, sir. Congressman, those numbers that I just mentioned, $1 trillion, only 16 million more Americans. How do you sell that to the public?
Well, I don't know where that comes from. I think it's one of the Senate bills, and, I'm not familiar with the Senate. I know that the House bill that we unveiled on Friday, will cover almost everyone. I think it's estimated to be 97% of the people. We don't expect to have a problem paying for it because much of the pay for is going to come from cuts, if you will, in some of the existing programs, that we expect will actually get a lot of more beneficiaries and won't necessarily need the same reimbursement rate. I think part of the problem, Mark, is that there are a lot of different bills. The congressional process, not like there's just one bill.
Right. Well, Congressman, is it fair to say that this is going to result in higher taxes on someone?
I think that there will be a revenue source, but I think that a good part of it, if not the majority of it, will be paid for through cuts in existing programs. And the reason for that is because in the long run, it saves money. So in other words, let's use the example of a hospital. If a hospital, doesn't get as much money per person from the federal government, they'll end up with more money because they're going to have more paying customers. So you can pay for a lot of this up front with cuts in existing programs because a lot more people will be paying for their freight, so to speak.
Right.
And in the long run, you save money. So that's how we're going to pay for a good part of it.
Congressman, what about this idea of a public insurance plan that would go alongside this plan? The Republicans say that's a deal killer. Is it?
I don't think so, because I think that the Republicans that I speak to and those who are opposed to the public option now, and understand it's merely an option, people can choose a private or they can take a public option. They just want a level playing field. They say, look, if you have this healthcare marketplace where you can choose a plan and you have all these options, it's okay if the public plan is one of several options as long as there's a level playing field. In other words, that you make it so that it doesn't outgrow the private plans.
Well, do you think that'll be part of an eventual compromise?
It's actually part of what the House unveiled on Friday, in the sense that we say that, that the public plan has to be paid for just with the premiums that people pay. It wouldn't be subsidized by the federal government. Things of that nature that create the level playing field that are going to be in the House bill and hopefully in the Senate bill as well.
Well, are state co-ops a viable alternative to a government-run health care plan?
Well, I think that we certainly would look at anything. But, if you think about the public option, it's not government-run. It's just like Medicare. In other words, Medicare and Medicaid are essentially government options right now. The system is still private. It's just that the government is paying the bill for the doctors or the hospitals. It's not like the British system where the doctors and the hospitals are run by the government. It's simply saying that the public would have, the government would have an insurance plan that you could opt for, just like Medicare or Medicaid.
Congressman, is it wise to try to push this through without any Republican support? It looks like this is going to fall along party lines.
I think ultimately, Mark, because remember, we're at an early stage now. There hasn't even been a hearing on these bills. I think that ultimately there will be some Republican support. I think there's a lot of misunderstanding, and part of that comes from the fact there's so many bills out there. But once these start moving, I think you will get Republicans that will support it because they'll realize it's a change for the better, but not something that has the government interfere in any way.
Right. Congressman, we have less than a minute left. You're one of the senior members of the New Jersey delegation. You've been in Congress for a while, and you were there when the Clinton administration tried to get health care through. A lot of people said ram it through Congress. What's different this time around?
Well, the difference is that President Clinton said, here's the plan, take it or leave it. these plans, and there are many, are being developed by the Congress. And as we move along, there's a lot of public input, a lot of opportunity for change. And so I think that over the next few months, we'll actually develop something that everyone likes, not something that was just, came from above.
So it won't be perfect.
Well, I mean, look, nothing's perfect, but I think right now we have no choice. We have to do this because the costs keep going up, and they're just they're not sustainable.
Right. Congressman Frank Pallone of New Jersey joining us from Capitol Hill. Congressman, thanks.